Ooh, another white boy with a podcast. Pronouns, Jim Bro. Another white boy with a podcast. You want to see the video? It went viral.
Hi Gains Gurus and welcome to TMGP, the Muscle Growth Podcast, episode 22. I am your host, Roscoe, and today we're welcoming Dr. Jem onto the show. Dr. Jem is a dedicated chiropractor and injury coach with over 18 years of experience helping individuals recover from musculoskeletal injuries. She earned her Doctor of Chiropractic degree from Parker University and takes a holistic approach to treatment, incorporating techniques such as deep tissue myofascial release, active rehabilitation, and nutritional guidance to support her patients' recovery. As an injury coach specializing in powerlifting injury management and prevention, Dr. Jem emphasizes preventative care and works collaboratively with other healthcare professionals to provide comprehensive, tailored care for her patients. She is committed to patient education and empowerment, setting her apart as a leader in the field of chiropractic care. In addition to her work as a chiropractor, Dr. Jem is an accomplished powerlifter. Dr. Jem's dedication to the sport of powerlifting and her work as the head clinician with Kodiak Barbell demonstrates her passion for fitness, health, and helping others achieve their goals. Join Dr. Jem in this episode of TMGP as she shares insights into her practice, discusses common misconceptions about healthcare, and offers valuable tips for maintaining a healthy and strong lifestyle. Her unique perspective as a chiropractor, injury consultant, and an elite powerlifter will provide valuable insights for anyone looking to optimize their health and performance. Today's episode, we can look forward to insights from Dr. Jem related to injury consulting, rehabilitation, healthcare systems, injury prevention, the body being a master of compensation, squat technique, her thoughts on squat university, including thoughts about one's back ability, the infamous dead pig study, having a fixed stance for squat, ATG, weird exercises, and so forth, of training oneself when filming, the psycho-neuromuscular theory, pain through exercise, not rest, obliques training, and full extension sit-ups, and more. Hey Gains Gurus, before we dive into today's episode, we have a special shout out to our sponsor, Heart and Mind SA. If you're looking for a delicious way to boost your workouts, their creatine gummies can be found on Takealot and are the perfect fit. They're not just effective, but also a tasty treat you can look forward to every day. So, maybe it's time to be like me and fuel your gains with Heart and Mind SA. If you're injured or in recovery, check out theinjuryconsultant.com and consider getting a free consultation to see whether I can help you heal, restore, and thrive. Lastly, don't forget to follow us on all major social media platforms, including Instagram, YouTube, TikTok, and X. Find us at The Muscle Growth Podcast and myself at Reps with Roscoe. Welcome, Dr. Jem, to the Muscle Growth Podcast, where we explore subjects related to muscle science and hypertrophy. I'm thrilled to have you join us for today's conversation. Let's jump right in and dig into some exciting topics together. Can you briefly introduce yourself?
So my background, kinesiology major, I actually did my doctorate in chiropractic in Canada, which is quite distinguishable from the American curriculum. A lot more rehab based. And then when I married my husband, he owned a powerlifting company called Kodiak Barbell. And we realized that there was literally nobody out there formally educated to help people in the strength community because it requires a very, very different way of approaching recovery that, you can't just have them sit at home for 6 weeks. It's just not reasonable. So I joined Kodiak Barbell, and now I exclusively work with strength athletes in rehabilitation, and injury management, program management, all that kind of stuff.
And what did you do before that kind of thing?
So I was originally, when I met my husband, I was working in private practice. So I worked with a very broad scope of things. And in the Canadian curriculum, even in chiropractic, it's very, first 2 years essentially are done with the University of Toronto's medical curriculum. So you learn the fundamentals of diagnosis because there are chiropractors that work in remote areas. So we learn diagnosis of lung conditions, heart conditions, throat, nose, ears, all the basics of diagnosis. And so we do see a very wide scope of things, and we are kind of people who triage patients to who they should go. But I was just working in private practice. I was just helping, pretty much anyone from newborns to elderly and everything in between. And I mean, I myself was a gymnast since I was 3 years old. So I've always been in the strength community, but not as much from a professional capacity.
So did you graduate from the University of Toronto?
No. So I did my undergraduate at Queen's, and then our university for chiropractic school, there's actually only one in the whole country. So it's very different than America, where there's like 4 in every state. There's one English one in the entire country. That one you can do collaborations with University of Toronto. But I graduated from CMCC, and then I did a acupuncture certification in medical acupuncture from McMaster University.
Okay. And who do you find easier to work with, the newborns or the elderly?
The elderly. They don't
Okay.
cry as much.
Don't they?
Yeah.
Okay. No,
Yo, when you get a newborn crying, you're like, oh yeah, this is an additional layer of stress.
what are the newborns coming in for? I assume they don't bring themselves to the practice.
Well, it really depends. It's, parents obviously have different political standpoints on how they want to approach health, right?
Right.
They're like veering very strongly away from, especially with recent things, vaccination is a very hot topic. And what you do with your newborn child in Western medicine is now being criticized pretty strongly. So some parents, usually patients of mine, will bring their children and they're like, I just want to ensure they're hitting milestones. So we do neurological exams on infants that essentially there's different milestones of their development where they're supposed to lose certain neurological signs. So you can track these over time to ensure that their neurology is effective, maturing the way that it should be. I personally have beliefs regarding treatment of newborns and young children. I personally do not do that. I will assess them and I will teach their parents how to treat them, because I think that is a very delicate world to work in.
And what exactly are you assessing them for? You mentioned neurological aspects. Is it that as well as like walking or crawling, those kinds of things? Physical?
Yeah, so of course parents get concerned about their children. Anything that seems off of the normal track typically will concern a parent. So sometimes just getting the peace of mind of being like, yeah, they might be an outlier for these specific metrics. However, there's nothing that we can, see concretely is wrong with them. Sometimes there just are outliers because we just work off statistics and averages. But there are things that you can look for, like, for example, if some kids don't start crawling or walking at the right stages, they may have things like hip dysplasia, which should be assessed at birth. Sometimes, just depending on where people have access to healthcare, especially in Canada, not very easy to always get good care. If you live remotely, you may not even get a primary care practitioner. My family didn't, especially during COVID, because we had a shortage of doctors and that was all very messy. So they rely on whoever they can because, parents just, if you're concerned something's wrong with your child, you will do anything you can to figure out what's going on, right?
Of course. And with regards to living in Canada and not being easy to get top care, is that, and you mentioned the remote areas, is that, would you say, one of the biggest barriers, or do you think it's a system failure as a whole?
Oh, I could talk about this all day.
Or got time?
We have socialized medicine. It is It's interesting because I've lived in the US for 2 years now, and Americans all the time come up to me and they go,
In the
"Oh,
US?
you guys have," yeah, they're like, "You guys have free healthcare." I'm like, "Free healthcare? Our tax bracket, we pay like 50% to the government at the end of the year. So you're paying for it. You just don't get to use it because they fired pretty much every doctor and nurse that would not get the vaccine." And the last place I lived in Canada, I lived there for 4 years and I never once got allocated to a family physician.
Sure.
So
What, for your own health or for you
yeah,
to give advice?
yeah, for my own health. So you apply when you move, like, "Hi, I need a doctor."
Yeah, you would in 4 years, probably.
And they're like, "Okay, cool. We'll send you a message when one opens up." But they all quit because, I mean, obviously you'll call it conspiracy, but I know myself being somebody who went through, a professional healthcare system, if I didn't reiterate a very particular script about vaccination, not only would I not graduate, but I could also lose my license. And I know that because I went through it. And I know there are other doctors that were encouraged to speak a certain way, and a lot of them did not feel comfortable pushing the COVID vaccine. And a lot of them were fired for not taking the COVID vaccine, and we lost a ton of healthcare professionals. They had to close down emergency rooms, emergency departments in hospitals because they were understaffed. People couldn't get family doctors. My sister-in-law was pregnant in 2021, never got a primary care practitioner for herself or her child. They had to go to emergency department every time that she needed a follow-up.
That sounds broken.
It's really, really scary.
And that's in a like first world country. I come from South Africa, so it's still developing, I
Yeah.
guess. But we can
Yeah.
at least find a doctor sometimes, I guess.
Yeah, I mean, they've done telehealth. They've been
Oh,
pushing
yeah,
pretty hard in Canada
for sure.
because they've been able to, you could use telehealth, but the thing is, like, you basically call telehealth and say, "Hi, I want this drug." And they go, "Okay, here it is." But the reason why you're supposed to have a primary care provider is so that they understand your history
Yeah.
and to actually understand the risks associated with things. Um, but yeah, that doesn't, in Canada, you might not get that. And if your primary care provider has retired, a lot of people just are left with no care. It happened to a ton of my patients.
Jeepers, that's not good to hear. Yo, well,
Very scary.
hopefully you'll have some nicer topics to talk about. That is
Yeah, I know.
that is very scary. Well, let's talk about what you're doing and what you're contributing to the healthcare community in terms of injury consulting. How, like you mentioned that you started doing more of that, I think, when you went to your husband's gym. Is that correct?
Yeah, so he owns an online company,
Mm-hmm.
and he has employees. So we have a lot of powerlifting clients as a company. And what we noticed when we started dating was he would have a client get hurt doing some type of training in the powerlifting world. And you'd be like, "Okay, go see a clinician, go figure out what your diagnosis is, what we should be doing for it." And all of his clients would come back saying, "Oh, actually, they didn't tell me what was wrong, but they told me to stop training and to quit training for the next couple months." Right.
Yeah.
And so he would tell me, he's like, "Jem, is this accurate? Like, why would he need to do that?" And I'm like, "No, he doesn't. That practitioner is just not educated on how to manage people in the strength community because there is no formal education on that. You don't go to physio school or chiro school and they say, okay, for the powerlifting population, here is the curriculum that we're going to follow. These are all the chapters." It doesn't exist. You learn the basics and then you have to apply them and you learn in your own, clinical experience how to do this kind of stuff.
Absolutely. And I've done quite a lot of research on I guess they will prescribe the RICE protocol. Is that more or less what people are doing? The rest, ice, and compression elevation, is that still being prescribed?
I mean, when I was in school, mind you, that was like 2015. Um, that was when they started veering away from it. So, I mean, the interesting thing with healthcare is that the year that you graduated says a lot about
What you learned.
your approach.
Oh,
Yeah, because this isn't math. This
not
is,
that.
science is always changing, always developing. So especially in the world of rehab and nutrition, oh my gosh, like that stuff changes almost daily. You just can't,
Sure.
it doesn't matter what your opinion is, it's going to be wrong tomorrow.
No, I completely agree. So in terms of moving away from rice, what are the kind of alternatives or the more correct approach? Now, I know that the person who invented rice has actually come in and said, listen, I'm sorry, rice is outdated. And you know, he publicly apologized, and he said that people shouldn't do rice given the latest data. And now instead of resting,
Yeah.
and I think you're also quite a big proponent of moving to not only recover, but to prevent injury as well. And getting strength back is very important for a recovery journey. Instead of, like you said, no diagnoses and then being told not to train and just rest, which is, it doesn't make sense. You're never going to get strong if you're just resting. In fact, you're going to atrophy so badly that you're barely going to be recognizable.
Yeah. So what's interesting about that topic is, so as practitioners, we work off of something called clinical practice guidelines, right? These are guidelines that we utilize. They're typically monetarily driven, which is why I never really trust them 100% because a lot of it's just based on, oh, insurance should cover this amount. That's dangerous. But it suggests what a normal recovery timeline should be and what the best clinical outcomes could be based on research, right? So they know for inversion ankle sprains, rice for the first week, and then certain types of rehab and certain types of modalities will give you a typical prognosis of around 6 weeks time. So there was a point in time where the clinical practice guidelines suggested complete rest, right? There was a day where if you got into a car accident, you'd be given a cervical collar, even though you didn't break anything, and you'd be sent home for a few weeks. And then I believe it was in the late 90s, they started doing research on bed rest for people who were going to be going into space, because they wondered what are the actual effects on the body if you do not fight gravity. Just that alone. And I believe it was 4 days, your cardiovascular system will start to deplete in many ways. And I believe that after that 4-week time period, you lose about 1% of your VO2 max a day. Right?
Yep.
And that's huge for athletes. Your ability to absorb and utilize oxygen is very important for athletes. And then beyond that, around the 6-week mark, we start to look at bone mineral density loss. You will literally get osteoporosis in your hips and your lumbar spine, which are the highest fracture risks for the elderly that actually lead to mortality from bed rest. It seems like a really dangerous recommendation. But we didn't know this until we started thinking, okay, well, if we're going to protect our astronauts, what should we be thinking about? What should we be doing for them? What kind of health factors should we be looking at? So that's kind of interesting because they're totally unrelated fields, but that research drove a lot of additional research into these recommendations for rest for musculoskeletal injuries.
So that's super interesting that it was thanks to the astronauts that we now have better methods. Thank goodness for them. So
Yeah.
now what is the alternative, or what is the subsequent research? What is it saying? What should we do instead of bed rest?
You do everything you can. Everything and anything that you can do. And a lot of what I do with clients is actually assess based on their condition and based on their sport, based on their goals of whether or not they're competing. There's a ton of factors that go into it. But what can they continue to do that will not worsen their prognosis? And you just kind of flirt with that line of, if you go over this, then it might make things worse, but you stay just below that, so they can do everything they possibly can with whatever condition that they're in.
I like that. I like that approach. So it's multifactorial, it's person dependent, and it's micro adjusting depending on the person's conditions, depending on their sport, depending on their attitude, their mental well-being, all the rest of it, and trying to get them to do the most that they can without making it worse, basically, is what I'm understanding.
Exactly. Yeah.
For the astronauts that had to go through that horrific study, did they get back their like bone density afterwards with resistance training, or were they stuck?
You can. I mean, that's actually, it's funny because a lot of people, there's also research that says that you can't.
Yeah.
But I mean, osteoporosis, they call it, I mean, mind you, this is dated 2015 when I graduated. This is what they said. They said osteoporosis is a pediatric disease with geriatric consequences, meaning that you have a very particular time in your life to build bone mineral density. You have a particular time in your life to maintain it. So it's very difficult once you've reached that depletion stage. But then there's also additional factors, right? Sarcopenia, which is a natural age-related decline in muscle mass. You can certainly combat that with resistance training. I recommend I recommend anyone in the world to do resistance training. It doesn't matter what age. But another additional reason is that it's very hard to load your bones and maintain bone density when you don't have muscles to support them.
Absolutely. More muscle, less problems.
Yeah, exactly. I mean, that's what we tell ourselves, but
I think it's pretty true. I actually had Ginny McCall on the show, and she's the oldest ninja warrior, and
cool.
she's super cool. She's in her 70s now. Her daughter's also like the world leading ninja warrior, and she got her into the ninja, and she reversed her osteoporosis. The one before that, I'm not sure, it's not full blown osteoporosis, but the one before that, osteopenia, I believe. And she reversed that through doing ninja, through doing gym training and that kind of thing. And her bone density came back much denser, I guess, and much better than it was before all those things. So that's really cool. And that was in her late 60s that happened. So like you said, everyone needs to be training, not just young people.
Yeah. She'd be a great case study because I still get clients that are in their 60s that are like, oh, I had osteopenia. They prescribed me medication. They told me I can only maintain what little I have left. And I'm like, that's such a horrible way to look at things. Just be like, good luck. It's like maybe if they understood more about what we do,
exactly,
they would make better recommendations. But I mean, even when I did my internship as a chiro, I was working in a hospital with medical doctors because they're working on more collaborative approaches. And mine was very unique. There was 6 of us in my group out of the whole school. And we did a placement in a clinical psychology department. So we exclusively saw patients with psychological conditions who also had injuries. Because that really, really alters prognosis. That really, really makes things different. But in my time there, I realized that general practitioners, family physicians, it's not that they don't want to tell somebody to do exercise. It's that they were not properly and formally educated on what they should be recommending specifically. And I don't blame them for that because I don't think you can be a master of all trades. I think if you're going to know drugs, know your drugs well because our lives depend on it. And if you're going to know rehab well. But expecting a physician, family doctor to know all of the details is something that took me 10 years to accumulate in school and understand. I can't expect them to learn everything that they learned and then also the 10 years that I learned as well, right? So I think it's better to divide and conquer because there's a lot of stuff to learn.
Absolutely. I totally agree with you. So it sounds like the education system is flawed and that it's not being updated as quickly as it should, and that it's not the doctor's fault, especially the ones that graduated years back. Like they weren't taught nutrition, they weren't taught physical training, those kinds of things that hopefully now are going to start being taught, since there's a lot more literature coming out in the scientific community about it. I'm hopeful, but I'm sure the top universities will start implementing those strategies because they're so easy to implement. Like you said, like people need to know about the drugs, and those are very difficult to study and learn about, whereas exercise is maybe the best drug. But it's also so accessible, and you don't have to pay money to go for a walk, go for a hike, go for a run, do a pull-up. And that's I think it's something that's a bit lacked in the modern schooling system.
And I'd say it's getting better. I mean, the opioid epidemic certainly put a lot of fear in practitioners, because the accusation that they are getting people addicted to harmful drugs is very heavy to bear. And so I know a lot of doctors who are incredibly adverse to certain type of prescriptions because that allegation is heavy. People lost their lives because of, opiates. Opiates were supposed to be the next best thing, and they killed a lot of people.
For sure. And
so
because of addiction, I assume.
Yeah, because of addiction. And it affected a lot of people. My grandfather, actually, that's how he died. So it's like, I was one of those kids where everybody told me to always be a medical doctor, because I don't think if you're smart, then everyone just tells you to do that. And in my experience, I lived in Australia for a year, and I just took some time to really think about what I wanted. And I realized that I did not align with the medical community at all. I don't align with any of the sentiment. I think there is a very important place for them. I think that there's a lot of value in that. But it's interesting to me how even nowadays somebody will go see their medical doctor and they come back and they go, they just prescribed me medicine. I'm like, you saw a medical doctor though. That's their specialization is medicine. If you wanted natural stuff, you could go to an osteopathic doctor. And if you wanted manual stuff, you could go to a doctor of physical therapy. There's other types of doctors now that are starting to become more mainstream. So I think, it's also kind of like patient understanding of what these professionals do. And I don't think it's reasonable to expect every professional to know the world of every other professional, because it's a significant amount of school to just learn one of those, specializations. I mean, I don't want to learn about medicine. I was in school for 10 years. I'm exhausted. Like, I'm good.
No, I completely agree with you. And I'm sorry to hear about your grandfather, but I'm very glad to hear that you picked your own path and that you didn't listen to your peers, and that it sounds like it was the right path for you.
Yeah. I mean, anything that allows you freedom to push for the things that you believe is right is incredible, because, people ask me, what if you could do anything in the world, what would you do? I would do my job. I would do what I'm doing now. Like, there's really nothing else. I've identified a cohort of people that needed a lot of support, and I get to be able to help people for a living. It's sick. Like, I have nothing negative to say about it.
It sounds like you found what the Japanese term ikigai, which is basically, are you familiar with it? Yes. So
yes, I actually just learned that like 2 weeks ago.
Oh, no ways. Well, it sounds like you found yours, which is the kind of intersection between what you love, what you're good at, what can help society, and what can earn you money. And there might be one or two other threads to that I might be forgetting, but something like that.
Yeah.
And that's special, and you must hold on to that. I hope that can inspire some other people to go and chase their ikigai. Go research what that is to the listeners. It's very cool. It's a beautiful philosophy, I guess. Yeah. In terms of that case study that you mentioned, Ginny McCall, episode 6, I believe. If anyone wants to go listen, she's super inspiring. She only started at age 63. That was when she started. And she was a dancer and things before, so she was always fit. But she only did her first pull-up, I believe, at 68 or 69. And then her first salmon ladder, a salmon ladder, like one of those hectic pull-up things where you go up and up to the next round, like a year or two later at almost 70, which is, it's incredible. I really want to find a salmon ladder to see if I can even do one, but she's great.
All right. I'm like, uh-oh.
Do you know a salmon ladder?
Yeah, I have one in the gym that I work out of.
Oh, can you do it?
I have not tried, but I will let you know.
Please do. That's exciting. Don't hurt yourself though, but you'll know how you fix yourself if you do get hurt, which is at least something. Okay. I saw you had I'm going to go through a few of your Instagram posts that I really enjoyed. You mentioned something about your body being a master of compensation. Like, for example, if you probably have patients saying, I can still squat. Doesn't that mean it doesn't mean you aren't injured, basically, was what you were trying to say. Can you elaborate a bit on that?
So a lot of these posts that I make, they're typically inspired by clients, right? I'll have a conversation with a client and I'll be like, if I'm having that conversation with you, there's probably a lot of other people out there who should be having that conversation.
For sure.
And I think with powerlifting, especially, working with the world of guys who are totaling around 2K, it is honestly amazing what they can still do while missing muscles or, like the extent of the injuries that they've had. And I think sometimes they fall into this trap of, well, I can still squat. It's like, that's sick. I want you to keep being able to squat. Does that mean that you didn't tear your quad off the bone? No, but you can still squat. So when people use the metric of whether they can do the big three again, which is the goal of rehab, it doesn't always mean that it's done, right? Because I'm working with one client in particular right now, had an injury similar to my husband's, which my husband had a complete quad tendon rupture. He did not have a complete rupture. He had partial. And he's...
Ooh, another white boy with a podcast. Pronouns, gym bro. Another white boy with a podcast. You want to see the video? It went viral.
We realize he is like no hip stability at all. Cannot do a single leg stance. He cannot do a reverse lunge with a zercher. He like all these like relatively beginning rehab stuff, very challenging for him to do. But he can squat 700 pounds. Does that mean he's healed? Right? So I kind of look at these, I always call them prodromal symptoms. If there is something that is lacking and you're doing these compound movements, your body's going to start nagging you in little ways. You're going to get little heads up that, something might be a little bit off. And when you tear a muscle or something like this happens, that's a good indication that you should be going back to checking your basics. These guys, I'm sure, started with those basic movements 20 years ago now. So it seemed, nobody wants to do that. I get it. But when you go back to the basics, you get to do the basics, they realize that they cannot do the basics anymore. That's when they realize, light bulb moment, they're not okay. They're not 100% better. And, what we do is we find a rehab that matches them where they're at. And we find out the safest way that they can continue to train and to progress. They have to be able to implement some level of progressive overload. So that's looking at program variations, how to get relative intensity very high without absolute load being very high, how to use variations that actually address their issues, right? We don't want to just pull a variation out of our hat. We want to say if they're really, really weak in certain positions, whether it's their back, whether it's whatever, you're using a variation that emphasizes everything that they're bad at. And that's like rehab is the exact same thing. Rehab is just a list of exercises that you are terrible at.
Go I'd have a long list then myself.
I think we all do.
For sure. So the take-home message for that is to listen to your body and then to go back to basics, I guess.
Yeah, going back to basics and assessing those things will give you a good metric of what's really going on. Because I even find with people, especially who are incredibly strong, the stronger that they get, their body is brilliant at masking symptoms. Brilliant.
Absolutely. And I think anyone squatting 700 or 800 pounds is really, really, really strong, especially if they're
Yeah.
chasing a 2,000 pound total. Is that what you said by the 2K?
Yeah,
Yeah.
that's what most larger men, that's usually the goal for
Wow.
that
That's
population.
how big are these guys? How much do they weigh?
I think the guy that I was referring to that actually sparked that particular post, I think he's around 308.
Oh, he's big. He's a unit. Wow.
Yeah,
He's really,
yeah, they're not.
wow.
But, like my husband, for example, he was, going for the 2K total before
Yeah.
knees exploded. He competed at 275, I believe. So yeah, they're usually 242 plus, I would say. Usually. I mean, there's also freaks out there that are amazing, but
Yeah, those are huge men though. Those are really big,
yeah.
big guys. Sure.
I don't know, it's weird because I guess that's what I'm used to working with powerlifters. Like, we're not dainty people. We're not, that
No,
that
for
doesn't
sure.
help powerlifters.
For sure. But I guess like with the categories and everything, I know quite a lot of smaller, especially in the female side, like smaller girls that are lifting really heavy, but weighing like 50, 60 kilograms. And they just
Yeah.
have those.
I mean, I compete at 132 pounds.
Oh, wow. Okay. Sure.
Yeah.
And what's your total?
So the last time I competed, I dislocated my shoulder 5 weeks out of the meet. I was a gymnast, right?
Yes.
So my body is my issue with powerlifting is that I have a very difficult time generating tension.
Okay.
Because I learned how to move with flexibility my entire life. Like, I can fold my body in half. So powerlifting is the complete opposite. It's being as stiff as possible. And if I do a low bar squat, my shoulders will pop out at depth. Not fun. And I'm still to this day working on the shoulder that was dislocated before the last meet.
Sure. Sorry to hear about that.
I mean, that's part of the game. And I generally don't have a lot of pain, which, I mean, the pain is what annoys me. My bench is still fine because I'm very lat dominant, but I cannot low bar squat anymore.
So you just high bar squatting now?
Uh-huh.
Okay. Yeah, it's not.
Yeah, that's okay.
Yeah.
You just get jacked in a different way. It's fine.
Exactly. One of the tips that I saw that you mentioned was for squat, and that was stacking your pelvis under the rib cage. Do you mind just elaborating a little bit on that point?
Mm-hmm. Yeah. So this, I would say, again, usually inspired by clients. This is typically more applicable to, actually, I see this a lot in very large men, and I see this a lot in very small women. So like the extreme ranges of that. For beginner lifters, you've probably seen it. The first time somebody goes to squat, they just stick their butt out, they arch into extension, and they're like, that's how you squat. And that's fine until you start to get strong and the weight gets heavier. If you cannot maintain a very strong cylinder brace with tension, you will reach a limit for your strength very quickly, right? Because when I think about the squat, it's just transfer of force from the feet into your upper back. Anything in between that moves when it should not move for a technical competition squat to occur is lost energy. And if we're arching our back and we're flaring our ribs and we're not engaging our low abs, we're leaking energy all over the freaking place. And I see this a lot in beginners when they're learning how to brace properly and they haven't developed that skill yet. And then I also see it in large men who have lost a lot of hip internal rotation because they have difficulty achieving depth in the squat. Once you get to like 270 plus, hitting depth when you're really, really big, you just run into yourself. So they can compensate for that by arching their low back and getting a little bit more depth. And a lot of them don't have a ton of hip IR because a lot of them have been training for maybe a decade plus. They've been loading those hips. They have a ton of muscle mass. And maybe that was just a particular type of mobility that they were not focusing on before. It's just not a normal range that people think about, which is actually interesting because in my education, they taught us that the first range of motion you lose when you're developing, degeneration or osteoarthritis is hip internal rotation. And it's usually the first range that a lot of lifters will lose because of the compressive nature of all powerlifting.
Sure. And is that maybe one of the reasons, and you can correct me if I'm wrong, but I see a lot of the big guys having very wide squat stances. Is that so that they don't go into themselves, basically?
Yeah, I mean, for a lot of people, don't forget, a lot of powerlifting is still kind of inspired by West Side, which was equipped lifters having a really specific style. Everybody does it the same. That's the right way. That's the only right way. That was the mentality. And then now we have, small females like myself lifting. I'm not going to lift the same way that somebody who is 300 pounds at West Side is going to squat. It's just not the same at all. And a lot of what lift should look like for that particular athlete depends on the anthropometry of that athlete. How long is their femur? How is their mobility? How tall are they? All of these things, all of these variables. But yeah, I mean, some people just squat wide because they feel strong wide. Some people squat wide because they don't have range otherwise. Some people squat wide because they have a stomach. All sorts of things that people, we use our particular form to get around whatever we suck at is the truth.
And that makes perfect sense. But I think that actually leads quite nicely into the next question. What are your thoughts on Squat University?
Oh, you saw that, huh?
I did. But I haven't told you anything about my thoughts, but I've also got quite strong thoughts on them. So please do go for it.
They have their pluses as a platform. I think they were one of the first few platforms that were trying to provide education for people to help a community of strength athletes that have been underserviced by traditional physical therapy world. So I respect them for that. They put out a lot of great information. Do I agree with everything that they put out? No, I don't think anyone's ever going to agree with everything somebody says because it's going to be peppered by your own experience because this isn't math. It's just there's black and white and every single shade in between. And all your experiences are going to lead you to look at things through a certain lens. But I will say, I have made a lot of money off of Squat University teaching people about the tripod foot. Yeah, that has messed up a lot of athletes in the strength community, and it has given me a ton of fun.
Did you say the tripod?
The tripod foot. So Squat U taught people that they should have 3 points of contact in their foot, and that's how they're supposed to squat, maintaining a high arch, which based on anatomy and my understanding of anatomy and my education on anatomy makes zero sense. I don't think a high arch is a force-producing foot. I don't say that low surface area is a force-producing foot. And I've had a lot of people get hurt or be limited in their progress because Squat University caught a tripod foot. Enters GEM. So thank you, Squat University. However, yes, I think pronation is incredibly important for force production in the deadlift and in the squat. And I think if you're not able to properly pronate your feet, that will be a limiting reagent in your ability to maintain midfoot pressure and also to, strength production, period.
Sorry, please excuse my ignorance, but is pronation in or out?
So pronation is essentially flattening out your arch.
Oh, flattening. Okay.
Mm-hmm.
Okay. Yeah, I also I go through stages where I used to like Squat University because of exactly the same reason as you, and that they were a big platform and they put out really good content.
Yeah.
But at the same time, I spoke to my physio and a bunch of other professionals about it, and they all agree that they do put out some fantastic content, but at the same time, they're very dogmatic about it, and they are very sure of themselves to the point where they do also get quite a bit wrong, like the tripod foot, for example. One of the posts that ruined me a little bit was they said, and I think they've retracted this now, but basically they gave a very generic squat stance, and they said, this is how you should squat. And they kind of did the whole thing, and they said feet kind of shoulder width apart, 15 degrees toes, and then you squat. And I always try to mimic that because I'm following the steps given to me from Squat University.
Yeah.
I'm going to make it look like that guy.
Yeah.
Meanwhile, it's like every single person has a different anatomy, and that might work for a lot of people. Like maybe that works for most people, but it definitely didn't work for me. And they also made a lot of comments about going ATG, and my body doesn't do that, especially at that particular stance. And I screwed up my back really badly trying to force like ATG astrogras in that particular form, and I don't blame Squat University, but it was because of their content that I literally was bedridden for several weeks, not able to move my back or walk or anything because of that.
Should have called me.
I know I should have. But
like, listen, this is what we're gonna do in the gym this week.
Exactly. I mean, I couldn't get out of bed. It was really bad. I was on insane anti-inflammatories and insane painkillers. It was really a bad time in my life, but all good now. And we started squatting again, actually this year for the first time in several years. So getting back to it. But also, I don't know if you saw their stuff about dead pigs.
Yeah, probably. I mean, I don't think I follow them anymore because I was just like getting annoyed.
So basically, I actually see that you do full range of motion sit-ups where you extend your spine. Basically, their whole thing was a study done by Dr. Stuart McGill, who's one of their big wigs there. And
they still teach this in school, by the way. They will still.
I'm sure they do. He's a top professor and researcher. And basically what he did was he did the study with dead pigs. He took their spines and he basically put them in and out of he bent them basically. Yeah. And he did that like 20,000 times and all of them snapped.
Yeah.
And because of that, it was concluded that humans should not be moving their spines and that there might be a number of times that we can move our spines before they snap too, just like a pig's. What are your thoughts on that?
I was taught in school that if you did Russian twist, you would die.
You would die?
You would die. I mean, that's dramatic, but I think for dramatic effect,
I get you.
The pigs died, so why wouldn't we die? And then also...
I think the pig was dead, but I get you.
It died again. It died harder.
Again.
And the Superman position was also...
Yes, yeah. That's part of the Stuart McGill Big Three.
Yeah, so, I mean, I'm really sad to say that when I was a new grad, I perpetuated that idea.
Yeah.
I didn't know any better. And then I was a gymnast. I used to do gymnastics. And then talking to my gymnastics coach, he's like, if your spine is supposed to move that way, why wouldn't you strengthen it that way? And I was like, holy shit, my whole world is just fractured. Like, aren't you? And then I realized that you're only strong in positions you've built, resilience to. And if we're, just removing a certain range, then yes, you will be vulnerable in that range, and that will continue to perpetuate that perception that they've had. But you know what? I'm kind of half of a mind as someone who is a content creator. Maybe Squat University also posts this shit because they're like, this is going to ruffle a lot of feathers and it's going to get so much traction.
For sure. It's quite possible. They also post my last little bash on them. And again, I've stated that they do have good content. They do have top professionals. They have top athletes. So they know what they're doing for the most part. But they also maybe don't cater. They cater for a general population, and they don't say this might work for you. They kind of say this will work for you. Do it this way or die, as you said, for emphasis.
That's social media marketing, and it works because we're talking about it right now, right?
For sure, exactly, and they are one of the biggest platforms for powerlifting and weightlifting and things. So they've done really well. So congrats to them.
Yeah.
But the last little bash for me is they often recommend these exercises to warm up for like bench, for example, that are completely weird. And I've spoken to again, like some top professionals about it. And they all say like warming up has got to be specific for you, what you're going to be doing. And doing these completely random exercises is not as good as just like a progressive warm up, for example, a pyramid up on the bench, for example. But they, at Scott University, want you to have like a funny rubber band here, funny kettlebell, and hold it upside down. And it's like for stabilizer muscles, which are also, I've spoken to Ben Yanes about this, not really that useful for warming up for bench, for example. What are your thoughts on that?
Oh, hard no. If I see one more of my clients like literally doing this external rotation with a rubber band,
Yeah.
I will cut that
Yeah.
freaking band. Okay.
Yeah.
It is. Yeah. I know. I know Ben has also suggested that, like, yes, non-specific warm-ups do not make sense, and maybe it's just better to take the bar. And my only issue with that perception is that, there's kind of two categories of people. There's athletes who are training who have literally never been injured. They're just trying to get strong. Okay, sure. If they have pain in that lift, it's probably because they don't know that lift. But there's also another category of people who have had substantial injuries and substantial histories that will certainly benefit from doing prescribed exercises before they train. And, some people have neurological issues and they can't connect to a certain muscle group. And they need to do things to prime their brain to get into that motor pattern. And that can be incredibly effective at reducing injury risk. So there's kind of like two sides of that. I don't agree with the banded, like little tiny, like, stop doing banded rotator cuff work. Just freaking stop. Everybody stop. It's ridiculous. Your rotator cuff gets impinged because your shoulder blade doesn't move. So it's not going to do anything anyway. You're just going to get really jacked rotator cuff muscles, and it'll probably make your symptoms even worse.
I see really strong guys at the gym doing it, and I'm like, I can't tell them what to do because they're really strong and they're lifting way more than me. So it's like, hey, but it works for them. And even if it's a psychological thing, at least I guess it's giving them that.
I mean, some people, routine is something that
super important.
I mean, in my study in sports psychology, that is really big for athletes, having that routine, feeling that groove. So if that's what they got to do, that's what they got to do. But is that making them stronger at the lift or more prepared or reducing injury risk? That's questionable.
Very questionable. No, I totally agree. Another one of your posts was on when is someone ready to film themselves? Let's talk about that.
Oh, yeah, that was interesting. So it's super important for me with what I do now, because now I'm one of these digital people who live nowhere and work from nowhere. It made me realize why traditional physical therapy has failed, because it's very easy to give your patient a list of exercises and then go home and do this when you're not with me. And then when they don't get better, you're like, I gave them all the right exercises. It must be something wrong with them. But if you do not have eyes on the person, if you are not watching their rehab with very strong intent, chances are they're not going to do it right. Because again, rehab is a list of all the things you're bad at. If you're making someone move in a range of motion that they're not able to move in, their body will do everything it can to compensate around that. So with my clients, I get them to send me the rehab, every single rehab exercise. They send me it through video until they are doing it perfectly. And I have very high standards for how those are performed, because they have to retrain motor patterns. That is not easy to do. If it was easy to do, none of us would have problems. So a lot of my clients, and I get this, I was the same way when I started powerlifting. It's like, I don't want to be one of those people that like film myself in the gym because I don't think I'm hot shit, So getting over this perception that, it's vain or self-indulgent to film yourself from a health and rehab and a athlete perspective, video playback is one of the most effective ways to train your body to do something. Rewatching it literally does the same thing neurologically in your brain as doing it.
Absolutely. And I think that pertains to the neuropsychological theory that you mentioned. Is that the correct theory?
Yeah, neuropsychomotor.
Okay.
Yeah.
Oh, can you explain that theory? Is that the one you just explained?
But yeah, essentially rewatching videos gives the similar neurological adaptations as actually going through the exercise yourself. And the thing is that when you're training, especially when you're pushing the needle in a strength, type of standpoint, your brain is going to tell you shit that is not true all the time, right? You're going to go for your first 500 squat. Your brain is going to say, I almost died, right? It's going to say that. And then you'll watch the video and you're like, that was like an RPE 8. Why did it feel like it was a 10? But it's because we can't always trust what our brain is telling us. Our brain also is 10,000 years old and is going to work off of primitive data that is going to try and help you survive. And I don't know if people know this, but powerlifting is kind of a dangerous sport sometimes. You could end up in a wheelchair like my husband, right? Like there are serious consequences putting 750 pounds on your back. Your brain is going to try to make you not do that. So rewatching the video and getting an accurate appraisal of, did you even do it right? Did you even do what you felt like you thought you did? And was it as hard as you thought it was?
Absolutely. And like you said, it's a good way to monitor your progress and, like you said, to learn. It's great. And to send to your coach,
Yeah.
like you do.
Yeah, it's the best teaching tool. And so when I'm working with someone and I'm trying to explain where their deficits are, then they do a rehab exercise and it's very clear. I'm like, watch this again, see what you did. And then you can correct yourself. And then also just, from a fear perspective, powerlifting is very psychological. How you feel going into that, your confidence, where your mental headspace is at. If you are, went through something like what Stu did and you want to start squatting again, your brain is going to tell you everything it can to make you not do it. So I get my clients to re-watch their videos, their most successful attempt at whatever injured them, re-watch those, regain those confidence in what they've done. Because maybe you've deadlifted like 10,000 times in your life and one time you hurt yourself. Is it accurate to think every time you step up to a barbell, you're going to hurt yourself?
No.
So we have to untrain our brain from trying to protect us.
Absolutely. And that takes a lot of mental fortitude, I'm sure. On that note, I completely agree that powerlifting is a very dangerous sport, but I don't feel like it's any more dangerous than any of the other impact sports. There's danger getting out of bed in the morning. You could slip, fall, crack your head. And the same in the shower, like same going for a drive in your car. Like there is inherent risk in even just sitting down on your sofa watching TV. Like you are mortal and you can die. I'm not saying that that's a promotion for powerlifting at all, but like you gotta weigh the risk and the balance. Like the balancing risk is super important, especially in powerlifting. On that note, just don't do anything stupid. But you will get injured. Like I don't think there's any professional powerlifter or any athlete in the world who's at the top level that hasn't suffered some kind of injury in their life. I find it very hard to believe that any professional sport, maybe chess, I don't know, but you probably have like a little bit of brains problems or something if you that kind of injury, or maybe you had a cramp. I don't know. But I don't know if we chess as a like,
no, they probably get sciatica because they're sitting down
or something. There's probably something that they've had. Yeah. But I mean mostly for like a physical sport. Everyone gets injured, and it's more about how you deal with it. And hiring a coach or a consultant like yourself, a doctor, is probably a good. And like you mentioned, going back full circle now. A specialist, maybe not a medical doctor, maybe a medical doctor. I'm not saying there aren't some medical doctors that do know about this kind of stuff, but also maybe looking to find a more niche specialist, like you mentioned, a doctor of physio or chiro or something more specific, I guess, is also a good option.
Yeah, 100%.
So last kind of question before we wrap up. Can you just explain the importance of oblique training?
Oblique training. You are putting me on this spot. I thought you said you weren't going to do that.
Sorry.
So actually, this goes hand in hand with what we were chatting about earlier, which is the stacking of the rib cage over the pelvis. The obliques are a very, very strong muscle that can help you achieve that. So when I give people rehab, it's not always just, okay, you have this injury, you're weak here, we're going to do exercises there. A lot of it's also what is going to make them safer in that lift, and then also what is going to make them better at that lift. So if people are having issues with flaring their ribs or arching their low back during a squat, I give people a lot of lower ab work to do, and I give people a lot of oblique work to do. Because if they can make that mind muscle connection really strong when they get under the bar and we're trying to implement the cues that I've given them, it's a lot easier because they've just blasted that muscle for 50 reps.
And I think it's an often neglected muscle to train. But
yeah, powerlifters, we don't like doing hard stuff. Like, we don't like doing core. We don't like doing cardio.
I don't think anyone likes doing core or cardio, actually. I think that's just normal.
But
yeah, but especially with the powerlifters.
Yeah, with prep movements, it's definitely a very, very helpful one. The thing is, you can always give cues, and cues are probably one of the most effective ways to help somebody. However, not a lot of people respond well to auditory stimuli, right? I'm one of those people. I have to feel and touch everything. Everything. I have to feel it. So when someone says, okay, make sure you're doing midfoot pressure or pack your chin harder, or I'm like, I have to physically go through that first to be like, what's that supposed to feel like? And then I can code it in my brain. So it's another way that you can double down on a form change that isn't just verbal. It's a tactile way to do that.
Absolutely. So you're saying when your husband's there shouting up, 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 it's not helping?
No. Sometimes it goes down.
Oh no, that's no good.
Actually, it does help me. When people scream at me, I perform a lot better.
Oh, I think powerlifting is the sport for you then.
Mm-hmm.
Absolutely.
Yeah,
People love to scream, which is good. It's hype.
I love it. The energy in the room when you have that last deadlifter of the day at a competition, there's nothing like it.
I'm sure. So, finishing off, who are your favorite icons or role models in the powerlifting industry or the health industry that you look up to?
So I have a political view on this, which I don't believe in icons, because my allegiance is with God. So I don't like idolizing people. There are people who put out information that are great. My husband, obviously, he's coached me for years. I think he's one of the most brilliant powerlifting coaches I've ever known. And then he also works for Prescript, and there's a ton of, Jordan Shallow, the muscle doc, and all of those guys at Prescript, they put out a ton of really, really great stuff. So there's a lot of people I respect in the community for sure. I don't know if I idolize them though.
Absolutely. So in terms of who you'd recommend reaching out to have on this podcast, it would obviously be your husband.
I think that would be, you'd be in for a ride. You got to strap in, because he'll say things.
I'm excited. I will reach out to him. I have quite a roster lined up at the moment, but I will definitely be reaching out to him. Is it Stu?
Yeah.
Okay. Well, you must give him ample warning and tell him to get his best. I guess, as you said, his best answers and his
unhinged behavior.
Yeah, that's what I was trying to look for without knowing the exact PG words to use.
But it's funny because we do very similar styles of work, and I was formally educated for a decade, and he worked in person, personally training people from the ground up, built this company, and so we came to very similar conclusions, but we're very different in our demeanor.
It's very interesting that you're able to cross paths with such different kind of initial directions.
Do you know how we met?
Didn't you say I can't remember, but you did mention something right at the beginning about finding him at the gym or something, or is it different?
Yeah, we
At the
met
gym.
at a powerlifting gym.
There we go. Hey, was he? Did you see him putting up mad numbers? You're like, that's impressive. But can I get your number?
Oh, he terrified me.
Oh, did he?
Yeah, because I'm pretty quiet. I'm softer spoken than him for sure. And he was like the hype in the room when he had to do something was like he would pace around, he would like growl. Like I was like,
Like full bear mode.
yeah. And so I've known him for a couple of years, and then he eventually approached me. I think how he got me was he showed me an injury that he had. He's like, I know this
Ooh.
is gonna get her. It's gonna make her talk to me.
Oh, shame. Was it a really terrible injury?
Yeah, he fractured his shoulder blade in two pieces and tore his pec.
That is quite awful.
Yeah. So I was like, oh, this is sick. I'm into this.
You're like, that's hardcore. That's hardcore.
Yeah.
No, for sure. All right. Closing thoughts. What advice or parting words of wisdom do you have for our listeners who are looking to embark on their own journey of muscle growth, strength, and health?
I would say just talk to as many people as you can. And I like that people have conflicting opinions in this world. There is nothing set in stone in this world. And that's a really good thing because it makes people talk. And the more that we talk about things, the more that we can ultimately help other people. So talk to as many people as you can, really embed yourself in that community because there are a lot of people there that can help you and that have amazing ideas and a ton of experience. So yeah, I think that's what I would say.
I completely agree with that. And on that note of talking to as many people as possible, I completely agree, like I said. And another way you can do that if you don't like talking to people is just listen to this podcast because we'll have a new person on every second week. So that's fantastic. And thank you so much for your time. I really appreciate it. And that's a wrap.
Yeah, thank you so much for having me.
My pleasure. Thank you for tuning in to the Muscle Growth Podcast. If you found value in today's episode, we'd really appreciate it if you could leave us a 5-star rating and a quick review. It helps us grow and reach more people just like you. Don't forget to follow us on all major social media platforms, including Instagram, YouTube, TikTok, and X. Find us at the Muscle Growth Podcast and at Reps with Roscoe. For more insights, exclusive content, and full episodes, visit themusclegrowthpodcast.com. Your support truly makes a difference, so please like, share, comment, and follow. We're grateful for every bit of it. Until next time, keep pushing your limits and staying focused on getting bigger, stronger, and better.